All right, well, we will go ahead and get started. Good afternoon. This is Jasmine Page. I'm the Quality and Data Coordinator at the Indiana Primary Healthcare Association, and I would like to welcome everyone to our Social Determinants of Health Data Users Group webinar series. As if this is your first time being on this call, this is a group that convenes on a quarterly basis, and we talk about various social determinant of health topics. And lately we have been featuring various national cooperative agreements and having them share different programs that they have available. So this month, our topic will be on building your social determinant of health roadmap for children and adolescents. Before we begin, I just want to have a few housekeeping items. One, please keep your phones muted to eliminate any background noise. If you do have another call, please don't place us on hold. Just go ahead and disconnect your audio and then reconnect once your call is over, so we don't have to hear any of your hold music. Also, we have enabled the chat box feature on our Zoom. So if you have any questions for myself or the presenter or anyone else, any other of the participants during the call, you can use the chat box for that. Wanted to remind everyone that the webinar today is being recorded, and the recording will be posted on our website shortly afterwards. And if there is anyone who's on the line right now that's not speaking, if you could mute your phone or your microphone on the computer, we appreciate that. Finally, we will have an evaluation poll at the end. Please provide us some feedback. We are HRSA funded, and we like to prove to them that we are giving content and training that is relevant and that you all find useful for your organization. So please stay until the end to complete the poll. So our purpose for today's meeting is to learn about how your health center in partnership with schools can better organize your services and programs to address social determinants of health and create child and adolescent-centered systems of wellness. The objectives for today, we have 3 objectives. The first is to identify screening tools to detect social needs and strengths for children and adolescents. Second, we will understand the benefits of school-based partnerships in addressing social determinants of health. And third, we will describe best practices in social determinants of health care coordination and follow up in the school setting. The purpose for this group is to provide a space for community organizations that are interested in social determinants to come together, where we can really share ideas and information and gain a knowledge about existing programs that currently address social determinants of health, and that later, after the call, you can then engage with those partners and with one another and generate synergy to maybe implement some of these programs at your own health centers or collaborate in other ways. I'm pleased to welcome our presenters today from the School-Based Health Alliance. We have Andrea Shore, MPH, who is the Director of Programs for the School-Based Health Alliance. She oversees several of the organization's initiatives, including the Youth Safety Net Project, Hallways to Health, and expanding partnerships in disseminating HIV prevention materials to reduce HIV and other STDs among adolescents. She also manages the program content for the annual School-Based Healthcare Convention. Andrea has more than 20 years of experience in the public health field, where she has led child and adolescent health and youth development programs and initiatives, many of which focus on the intersection of health and education. Her most recent positions prior to the School-Based Health Alliance include Director of School Services at Metro Teenage and Program Manager for Health Services for the District of Columbia Public Schools. She has a Bachelor of Arts in Child Development from Tufts University and a Master of Public Health from Emory University. And then our main speaker today is Selena Moore. And as Program Manager for the School-Based Health Alliance, Selena Moore, MPH, manages the Youth Safety Net Program, a national training and technical assistance cooperative agreement from the Bureau of Primary Health Care, or BIPIC, aimed at improving health equity and access through training and technical assistance to safety net providers serving school-aged children and adolescents. Through the Youth Safety Net Project, Selena facilitates training opportunities for school and community health centers on a number of topics, including adolescent health, social determinants of health and enabling services, and school and health center partnerships. Selena also oversees the Alliance's youth development endeavors, including the Youth Advisory Council and Be the Change Youth Training Program at their annual convention. Her work prior to the Alliance focused on health education research for school-based public health interventions and community-based strategies for childhood asthma education and management. Selena obtained her Bachelor of Arts in Globalization from the Ohio State University and a Master of Public Health from the University of Virginia. And with that, I'd like to turn it over to Selena to go with her presentation.
Thank you so much, Jasmine, and thank you to everyone who is on today. As she mentioned, myself and Andrea have both working on the Youth Safety Net project, have done a lot of work in this area, and while I'll be the main presenter for today, she will be on as well for our Q&A after, should you have any questions. So as a reminder, this is about building your SDOH roadmap for children and adolescents. And the School-Based Health Alliance is a national organization that is the voice for school-based health care in terms of the centers and their programs, and we'll talk more about those later on in the presentation. And our mission is really to improve the health status for children and youth through our research, our programming, our advocacy, our research work. We really believe in the transformational power of the health and education sector and bringing those two together to meet the needs of children and their families. And having those two come together allow many great things to happen, and we're excited to share that with you all in this presentation. And as you, again, just so you can see who we are since we're not on video. And before I go any further, I would ask all of you to fill out this short poll so that we can learn a little bit more about each of you and where you are in your school-based health partnership. Okay. I think we can now see the results, if we could, Jasmine.
I only have one person that's completed it, so I don't know if we want to wait just a few more seconds.
I know we do have some people joining by phone, so unfortunately you may not be able to do it, but for those who are, we're asking you to tell us a bit about your school-based health partnership. So if you are operating school-based health centers, or if you have a school-based health program, you might not be physically in the school every day, but you have a partnership going on, or if you don't have a partnership yet, we'd like to know where you are.
Okay.
Oh, you're checking in? Oh, you go there. I'm just setting up for, yeah.
Okay, so we have some SBHCs on the line, and we have some who are hopefully looking, since you're here with us today to start. So that's great to know. Thank you all. And as Jasmine mentioned earlier, for anyone who's just joining, please mute your phone. Thank you. And we went over them, but for anyone who's just joining, the objectives for this webinar today that we really hope you can walk away with is learning about the various screening tools that are available specific to children and adolescents, how partnering with a school can help you to identify and address your the SDOH needs of children and adolescents better, and then some best practices to take away for those who are currently SBHCs, or if you're starting a partnership with school, ways to ensure that that partnership can be most beneficial when coordinating care around social determinants of health. So I want to start you all off getting to know someone. I want you guys to meet Anna. In November of 2014, Anna was in crisis. During an appointment and screening at the Curtis High School SBHC, the mental health counselor learned that Anna was living at home with her physically abusive mother. With the help of the school-based health center social worker, the mental health counselor was able to help facilitate Anna's removal from her mother's home and into a safe and caring environment with her grandmother. Months later, friends of Anna's, who had also been to see the health center, health educator at the center before, brought Anna in for reproductive services counseling. After a discussion with the health educator, Anna was able to get started on birth control and get tested for STIs. During that same screening, she was also referred to the dental hygienist. But more importantly, because of the existing relationship with the center, Anna felt comfortable disclosing a history of sexual abuse. The health educator explained the mental health services available, and Anna agreed to start regular counseling with the mental health counselor. And what I hope you all can glean from that story is several things that happened, all related to social determinants of health. While that wasn't the initial reason for Anna's visit, she was coming in for a regular scheduled appointment. Having this SDOH screening tool RAPS used in the center for all patients, regardless of the needs that they come in for, allowed them to identify some really important needs that Anna had related to her health that weren't just clinical. And so you see them recapped below. And because of that and the services of combining health educator, mental health counselor, and social worker, they were able to meet a number of needs that Anna had and provide her the care that she was either seeking originally or, because of the relationship, decided to disclose to ensure better health for herself moving forward. And this is just an example of showing that from housing instability and food insecurity to social isolation and exposure to violence, understanding the health behaviors of adolescents and their willingness to seek care depends on asking tough but critical questions that arise from screening tools and the brief intervention behaviors that come in the conversations after, and that these screening tools can serve as a gateway to providing interventions that address adolescent needs beyond the clinic walls. And so what are some of those screening tools that are for social determinants of health needs and strengths? And we're going to talk about the importance of strengths just as much. As I had said before, there's so many different social determinants that our young people are grappling with. I'm sure you all can think of many more that you've seen or just watch the news, and you can imagine the things that they're dealing with that are maybe invisible on the surface, but internally is having an impact on their well-being, socially, emotionally, educationally, physically. And when they are coming into your center for care, they're bringing all of these along with you. And when they're going into the school setting, they're bringing all of these along with them. They don't just stop at the door. And for each social determinant of health, these will hopefully look very similar to you all in terms of the social determinants that we talk about even for adults, but the way in which they impact you can be very different. And so when thinking, for example, about having a safe home, like was the case for Anna, what that means to have a stable family relationship means significant reduction in stress and allowing for better healthcare related decisions. There's also thinking about just the sheer having health and healthcare access, which having the school-based health center provided that place where Anna and her friends could access care easily, where they spend most of their time and at no cost to them. And you all, as well as many other physicians, understand these needs and know that patients' social needs are as important as their medical needs to address. But when we talk about the confidence level of knowing what to do once these needs are identified and how to address them, that's where we see the hesitance and where there's more need to assist providers and health centers in knowing what to do after identification. And so when we talk about social determinants of health and what I showed just on the previous two slides, it looks a lot at the needs, usually from more of a negative standpoint in terms of how is one adversely being impacted by their education or their work or lack of income or unsafe environment. But it's so important for everyone, but especially when thinking about children and youth, that not only screening them for determinants in terms of needs and deficits, but looking at their strengths as well. What might be built-in or supporting factors in their lives that are helping them to thrive, not just survive, or that could be part of the plan in terms of helping them to address a need that is impacting them negatively and turn that into something positive, given the strengths that they have built in and their own resiliency. And it's so important for providers and staff to screen for both. And so there are many key considerations when considering screenings, regardless of the tools that you use. And there are many different youth-friendly tools and evidence-based tools that we'll talk about shortly. But regardless of the tool you use, there are key considerations to keep in mind. The first is to normalize the process, being transparent and demonstrating that screening questions are given to all patients regardless of the reason for their visit. If you remember in the story about Anna at her high school SBHC, they were utilizing a screening tool and it's given to all patients every time they come in, regardless of the reason they come in. So it's not that you're targeting certain students and they feel that they're being highlighted in some certain way, normalizing this screening tool as just a normal part of receiving care at this center. The second key consideration is to talk the talk. It's important not only in normalizing the process of having a screening tool at your health center, but normalizing the questions and helping you to understand in terminology that is relatable to them what social determinants are. We use that term a lot in our health fields and it's assumed to be readily understandable, but talking to everyday youth and teens, social determinants, they don't know what that means or they may not, but they do understand when you're saying, asking them, you know, how often, how many meals a day do you get outside of school? You know, are you able to play outside of your house? They understand those type of scenarios. So making sure that the language that you're using and whatever comes out of the screening tool, that when you ask questions, it's in a respectful way, not conveying blame, but letting you know that while they, even if they don't want to discuss what's on the screening tool at that time, that your door is always open. The next consideration is to go digital. We live in a very tech-savvy time, and teens and the younger generations are definitely leading the way in that. And so, and along with being relatable in your process and the way that you speak to them, consider having web-based or an web-based screening tool, whether you have a tablet in your health center or you're using one that's built into an app that they can get on their phone, or even if it's a computer set up in the waiting room and they click through the survey, like a survey gizmo. Web-based can be more effective sometimes than paper-based in eliciting particularly highly sensitive information. Also think about who's the messenger. So for those of you who might be doing more of a conversation style with the screening tool where you're the one holding it and asking them the questions maybe during the visit, sometimes the responses you receive could depend on who's asking the question. For example, some centers have found that they found a higher prevalence of needs identified by their patients when it was asked by a medical assistant rather than a physician. And while it's going to be the clinicians that provide the care and continue the conversations after, in terms of first eliciting information to even know what needs need to be identified, consider who's asking, especially when it comes to you. Mum's the word, essentially confidentiality. It cannot be stressed enough, particularly with young people, and any information that they might deem really important and sensitive to them and that they don't want their friends to know or they don't want their parents to know. It's important for you to relay to them that just like coming in for a screening or getting a physical done, that this too is confidential and anything that you share, as well as knowing what the laws and rules are in your state related to particular aspects of health for adolescents and what they can consent for on their own, and making sure that they feel comfortable in knowing that what's shared is going to stay between them and you as the provider. Planning the how for the why. This relates back to what many physicians say about understanding the importance of social determinants, but not necessarily knowing what to do once it's been identified. How do they address it? So we definitely never want for anyone to shy away from screening because they don't think that they'll be able to meet the needs that are being identified, but ensuring that as you think about the screening tool that you're using and what aspects of social determinants it could uncover, knowing that you have a plan in place for if this screening tool is going to ask students about needs for legal advice or something in the legal sphere, what is our plan if someone were to choose that to get them the assistance that they need, and is that going to be in-house or connecting with an outside party? So just knowing that you have an opportunity and a place to connect all the social determinants that are within your screening tool to the correct service. And last but not least to all of these is having a youth-friendly approach. And that starts well before you've even screened. It's as soon as they walk through the door. And we'll talk more about this later on, but it's very important to have a youth-friendly approach to the health center. That's what even gets them in the door in the first place, and then ensuring that there's that shared autonomy and feeling of a partnership in their health for them to want to screen, to actually take the screening tool, answer it truthfully with as much information as they can, so that you can provide the best care. Now, this slide shows you some figures demonstrating how food insecurity can be a gateway for you in terms of finding out the needs of youth in your health center. You might have limited time and say, well, we don't have time for a full wraps or a full prepare. What else can we do to at least start to understand the needs? food insecurity screening can be a good starting point, and research as outlined here, and there's many more articles out there to support this, demonstrates that a positive food insecurity screening can be a window into other social needs. And then this slide shows you the figures demonstrating just how much food insecurity levels correlate with other social determinants. And so measuring food security on a continuum, especially for patients with low or very low food security, are considered food insecure, or not able to consistently and reliably access the appropriate quantity or quality of nutritious food. Each bar represents a different health-related social problem, including healthcare access, housing, substance use, education, and income insecurity. And as the food insecurity that you see on the x-axis, as the food insecurity increased from left to right, the presence of other social problems increased as well. So when thinking about if there's time constraints in place, when seeing patients at your health center, starting with food insecurity as a two-step can be a nice initial screen to detect if there are other needs that they might have. Now, for those of you who do have time for full screenings, you might be familiar with many of the screenings that are outlined in this chart. And this chart is not an exhaustive list. We are actually actively right now working on updating this very chart, which is available on our website, with more screening tools. But this highlights for you the top 7 that are predominantly used, and understanding how each of them works and what the needs that you see in your health center will help you to align best the type of screening tool that works for you. For example, when we talked about the importance of screening for strengths as well as needs, the shades, the second from the left, the shades screening tool does take a strengths approach. And so that's one that you might want to consider utilizing in your health center. Or you might be, as I had mentioned before, maybe you have a medical legal partnership, or it's something you're thinking about, or you know that that is an area of importance for youth and their families in your center. You would want to consider the iHelp, the third from the left, the iHelp screening, which was created by the National Center for Medical Legal Partnerships and takes on more of a medical legal approach. And then, as I'm sure everyone here is very familiar with talking about trauma and trauma-informed care, the Center for Youth Wellness Adverse Child Experiences questionnaire was built out of a lot of the research around trauma and ACEs, and can speak a lot to that if that's an area of particular importance that you know for youth in your center. And then the last one that I'll highlight is the last one on the chart, Bright Futures. For some tools like Bright Futures, they have guidelines and questions about screening for education social determinants. So as you think about, for those of you who said that you're a school-based health center or that you don't have a partnership yet and you're thinking about it, having Bright Futures, which is not only strengths-based, but also includes education indicators, such as school performance beginning in the early adolescence, really helps to highlight not only the needs for youth, but the importance of health centers partnering with schools to address those needs. And so with screening tools and a protocol in place, the next stop on your SDOH roadmap is developing a care coordination plan for identified needs, which includes establishing community relationships outside of the health center. These relationships need to go beyond the typical coalition building, and it's important to understand and assess the depth and breadth of resources that are provided in your communities and social service organizations to determine their capacity for referrals as you think about the needs that are being identified and whether they're being addressed in-house in your health center or out of house, and who best in your community can help you partner with them to meet these needs. And schools, as one of those care partners, can be really essential. So why schools? Schools are an ideal partner for addressing SDOH. As I mentioned before, the integration of having a school partnership really works well to be a place where you're meeting youth where they spend the majority of their time outside of home. You can access them much more readily, a place for follow-up as well, after care connections, and working with your education supports and partners such as teachers and guidance counselors can work with you in terms of being trained to also administer the screenings. So for even those who aren't running school-based health centers and you might have a partnership, having those who are in the school all day with the youth be a part of that SDOH screening and care coordination process makes schools an ideal place for this. Also, schools can be a resource for you when you're thinking about what are the community resources available to meet and address SDOH needs. Schools might already have those guides in place given their own work in the guidance counseling side, or they might have a school psychiatrist, and they could also be a point of reference for you to know where else is the best, for example, food bank to connect with when I have a student with food insecurity, and who is the best housing authority partner to work with when I have a youth who's experiencing homelessness. Schools can be a good resource to tap into to already have those key partners in mind and connected. This is a slide from our most recent census data. The School-Based Health Alliance puts out tri-annually a census to all school-based health centers and programs. And one of the questions that we asked for the 16-17 census was how many of the SBHCs were engaging in social determinants of health work, either within the health center or in partnership with community-based organizations. And from over 2,000 responses, we found that 77% of them were engaging in SDOH work and care coordination. And the breakdown of the services that they were meeting ranged all the way from, not surprisingly, food and nutrition services being at the top of that list, as we think about how food insecurity is a gateway identifier to other SDOH needs, all the way through to employment, criminal justice, health literacy. So there's a number of different SDOH needs that school-based health centers and school-based programs are working to address in connection with the schools. And those different partnerships can look very different. Here you see the school-based health center delivery models that start with your traditional school-based health center, so having that fixed on-site location, dedicated space in the school, through having a school linked. So it could be, physical space in one building, but it's in the elementary school, but it's open to the middle and the high school that's on the same land space, so a school linked program. There are also mobile SBHC programs. So for those of you who have mobile clinic vans and you might be taking them around to different housing sites or different areas in the community, using that same van and servicing school sites and having a partnership there where youth and their families are able to access. And then there are also telehealth SBHCs. Many of these are run in conjunction with one of the previously mentioned 3 models, so there is still always a physical presence, but there are some who are running telehealth only, and so which still requires almost the same amount of partnership and understanding with the school about having the services available and being able to ensure the technology is accessible. And with all of these models, it's all about making access a non-issue so that you can get at providing care to the youth. For those of you who are not providing, running a school-based health center or have a partnership yet, and you're thinking, oh, that sounds great, but we're not there yet, you also can run a very successful school-based health program and include SDOH in that work. This is a survey that we did last year with health center, FQHC, CEOs, and CMOs to find out, an idea of nationally who's running school-based health programs that are not school-based health centers and how are they doing that work. And this shows you the variety of different programs that are running in schools across the country, from oral health programs to doing the on-site sport physicals to doing Medicaid outreach and enrollment. Some of them are running after-school programs for youth, and ones that we've talked to, some of them are also the providers for the school nurses in their school districts. So whether you're running a school-based health center or a school-based health program, the school-based healthcare field has a model and a fit for everyone. And to make this a little bit more close to home for you all, for Indiana, as of the 16-17 census, there were 48 school-based health centers, 46 of them sponsored by FQHCs, just like you all here on this call today, and some of you who said that you're running SBHCs, you would be included in that number. And so 46 is a great number, but we would love to see that grow and love to work with you all to grow that number and provide even more access to children and adolescents in schools. So to help you do that, in order to collaborate and coordinate with schools, it's imperative to learn to speak their language. You're surely not able to just bring all of your equipment and go to the school's doors and say, we're here, ready to serve. To influence the schools and the people within the education system from top to bottom, you must have enthusiastic participants, your partners on the education side. And this can be challenging work for health centers looking to start these partnerships, and for even the school champions themselves who are excited by it, given competing school priorities such as testing and attendance and rates. And so to give you a few recommendations of how to go about speaking ed language, and there's much more related to this and things to consider, but to cover a couple of them as you think about, for those who don't have a partnership yet, or even for those of you who are SBHCs and you might be to another school district that you don't have a relationship with yet, thinking about the language that you use and how to connect with them. A few key things to remember is framing your approach and language around that school, whether you're working at the school level or the district level or the board, ensuring that the language that you use is speaking both the health and the learning language, showing and making that connection between what's important to you, which is the health outcomes and indicators, and what that means for them in the education space. How is this going to help? How does this partnership increase attendance? How does this partnership improve seat time? How does this partnership relate to graduation rates? So making sure that the language that you're using really speaks to the needs of the school as well. And keeping it simple, especially at the beginning, not bringing large amounts of data. It's also important to acknowledge an understanding of the pressures that they have. As I just mentioned, the very things that you want to make connections to them between the health and education are also the pressures that they're under to see, improve, or maintain testing, attendance rates, discipline issues. So being able to understand those and make connections as to why a school-based partnership with your health center is going to be beneficial on both sides and to the youth and their families themselves is critical. Communicating how poor health status actually does have an underlying cause to the achievement gap. So again, it's all about making the connection and communicate respect to the education system in the same way that you all might have various companies or entities that come in wanting to partner with your health center, and you want them to show you the respect of how the healthcare system works and that they've done their research to really understand the needs of your particular center. The same is true of the school and school-based setting. So next, I want to share this case scenario, this story about Felix, and then would love to hear from you all and get the discussion going to see what you think could be the next steps given the scenario. So you are a primary care provider. Felix is 13 years old, in middle school. He comes to your health center for his well-child visit. During the visit, Felix tells you he's had headaches quite frequently lately. You're using Bright Future's guidelines. When you ask about how he's doing in school, he says, "I guess okay." Based on that response and some of his responses to other questions about friends, you feel like there's something else going on. What else can you ask Felix? And so I'd love for y'all to use the chat box right now and let us know, based on this scenario, and you're using Bright Futures and the shortness of his answers, what else can you ask Felix? And thinking about what we talked about before with framing and the language that you use. Looking in the chat box.
This is Andrea. We're also a small enough group. I think people could feel free to unmute themselves and share.
Note takers are a very shy group today. So if you've asked Alex how things are going in school and he says, "I guess okay," one follow-up that you could give to that is, tell me what's okay about it, and see if that elicits anything specific, or knowing his school schedule and the classes, maybe going one by one and noticing, does he give a different reaction and response when he's talking about his language arts class versus when he's talking about science or at lunch, and seeing both verbally and non-verbally how he's reacting to see, is there a pattern about in between that time period when he's going to his math class, he gets quiet, or he's really chatty about all the great things that are going on in his biology class, to use to figure out what some next steps could be and where more attention needs to be paid. So using motivational interviewing, you learn that Felix is getting bullied at school, which leads to his headaches and his desire to stay home from school. Luckily, your health center has an MOU with Felix's middle school. One of the community outreach workers, Antonio, provides in-class health education twice a month to support the health teacher's curriculum. Antonio has developed a relationship with many of the school staff members through his collaboration, including the school counselor. So based on now you understand what the underlying issue is for Felix's headaches. It's bullying at school, and you know about the community outreach worker, Antonio, and his health education class. What are some steps you could take to assist Felix? And feel free to chat them, or you can unmute and share aloud. So I'm seeing talk to Antonio about when the next class is and see if Felix might want to attend. That's a great next step. Any other suggestions? You could also, given Antonio's relationship with other school staff, you could, from talking with Felix and seeing if there are other school staff that he feels comfortable with, he has a good relationship with, and seeing if any of those are the same people that Antonio has a relationship with. And with those, champions in Felix's life, have them be the ones to see if he might want to attend a class with Antonio or go with him to the class if the time allows, so that he feels supported from both sides. Amy Lopez says, link Antonio with the outreach person and school counselor. Exactly. Perfect. Thank you, Amy. It's all about making connections. Any others before we move on? Okay. Thank you all. And so I hope that you, with scenarios like this, it's helping to really think through all the considerations when it comes to care coordination. And so when we've talked before about, I have a screening tool, it's utilized, it identifies needs. Now we need to provide care, and understanding, is that happening in-house or with a partner such as at school, thinking about the different ways that that can take place. So via referral, via a warm handoff, which would be more like the Felix scenario of him going to Antonio and the outreach partner taking him, to connect with these new people. Engage in care management, so scheduling an appointment for the young person, and all the way up to even utilizing a closed loop communication, which then is not only do you know the need of the student, you're connecting them to care, the appointments are being made or connections are being made, but there's also follow-up that you as a provider then know the outcomes if and how the resources or connections made, what the outcome of that was, to continue that relationship with the student. Because in all of this, it's not a one-time. Social determinants are not a one-time fix, and so neither is the care that needs to be provided. And so knowing as much as you can about how different aspects are impacting young people and whether or not the resources you're providing are effective and meeting their needs is so important. And so in demonstrating the value of a school-based SDOH partnership and the work that you can do. There's many different ways to demonstrate the value, but I'm going to touch on just a few of them briefly today. The most important one is building your wellness team. As I talked before about having those partners in the school setting that are your champions and that you work with to create the vision and the purpose of your school-based partnership, it's so important that you think about every aspect of the school life. It's not just we're located in the school to provide, medical or behavioral services, and we sit here in the building, but what does it mean for us in the large scale to be a part of this school system and looking to make changes? And it needs to be a diverse coalition of school and community stakeholders and champions and supporters and implementers who serve many different functions. And this is just a few of them outlined here as you think about what it means to partner with a school. It's engaging all of these different aspects. Every person has a role to play who invests in this shared vision of your wellness team. It's also very important to cultivate a youth-centered environment. And also, and one note I do want to share is absolutely, just going back a second, the school nurse can definitely be essential friend and partner to you in even getting in the door and continuing that care coordination. If you are a school-based program, not a health center, she's there during the times that you're not and can really be essential in that closed loop coordination and follow-up. As I had mentioned before when we were talking about key considerations for screening and having a youth-centered approach to how you screen, it's so important to cultivate a youth-centered environment throughout your health center, whether it's community-based or school-based. And there are several partners, whether it's the Adolescent Health Initiative or the Search Institute, who do a lot of work in this. The Alliance as well has an entire toolkit that covers different aspects, but it's so important to establish youth partnerships at all ages, but especially when you get into the adolescent age, and they are the ones, making healthcare decisions for themselves, needing to be as informed as possible about their own care and whether they're transitioning to adult. And so ensuring that they understand that this is a partnership in their health between you and them, and you can utilize youth-led assessments to help you ensure that you're meeting a youth-centered environment and that they feel welcome and respected in the center. On the latter end of having your partnership connected and starting your partnership, being able to translate the social determinants of health work that you do into outcomes, and being able to relay the importance of this work and outcomes. And so this relates to the noun what of linking social determinants of health to an appropriate enabling service. Having strong enabling service programs, which is what essentially you're doing once you get past the identification phase of social determinants and you get into the care coordination. You are providing enabling services, and understanding the difference between the two, but how they complement each other, will lead to being able to provide targeted enabling service interventions and better patient outcomes. And having structured enabling service data, particularly when you're working with a school, that can show the non-clinical staff from your own health center, like the health educator and the Medicaid enrollment specialist, all the way to the school psychiatrists or school nurses working with you, to show and demonstrate the value of your health center, the health center program, all that goes into being able to fully address social determinants and the different moving pieces and people that it relates to can help communicate the complexity of the patient population you're working with and whether or not these services that you provide are enough for the needs that are being identified. So at this time, we're going to open up to questions. So please use the chat box to enter any questions you have, or if you're feeling so bold, to unmute yourself and ask a question aloud. And while you're thinking about your questions to add in, I want to just share a few resources and upcoming events that we have at the School-Based Health Alliance. Our health centers and schools partnership resource is available for free on our website as part of the work with the Bureau for Primary Health Care. And it's not only a resource, it can help you with case studies and tools to start your own partnership. We also do provide partnership trainings outside of the grant. We can work with you. We've worked with many other PCAs, including Maine and soon to be South Carolina, Oregon, Missouri, on health center school partnerships, whether you're starting a school-based health center or a school-based health program. And so you can access the resource for free, as well as connect with us offline about having a training for your health center or health centers. We also have an Adolescent SDOH blog on our website, coordinating care around the social determinants of health, and some of the information in this presentation was in, you'll find in the blog series, as well as a school-based medical legal partnership fact sheet we just put out this year with the National Center for Medical Legal. And lastly, here are the training opportunities that we have that are currently open to apply for. So if you're looking to improve on the care that you provide to adolescents, and you do not have to be a school-based health center program to apply and be a part of it, think about joining our Adolescent Health Echo that starts in January. For school-based sites, we also do have a diabetes learning collaborative starting up focus on pediatric and working with elementary schools. And that one begins in February. So go back, if there's any questions, feel free to ask them now. And I'll also turn it over to Jasmine to do.
Yes, thank you so much, Selena, for that. I am launching our evaluation poll right now. So if you're able, please complete this. It should take no more than just a couple minutes just to help us as we continue the social determinant of health webinars. Also, if you are interested in contacting Selena or Andrea or want to learn more, we will be posting the slides and a recording link for today's webinar on our website, indianapca.org. But thank you so much. And if you could please fill out the poll, the evaluation poll before you leave this webinar, we would appreciate it. And I believe Selena has, on the last slide, has her contact information as well. And I see it's also in the chat box. Thank you so much, everyone, for your participation, and have a great rest of your afternoon. And thank you so much to Selena and Andrea for being on today's call. We definitely appreciate all of the great resources and information you shared.
Thank you so much for having us. And we hope to connect with all of you again soon. And have a great day.